Every day, Manitobans are working hard to build the best life for themselves and their families. But they're not doing it alone. Behind the scenes, doctors are working hard to care for their patients. They're also pushing for better healthcare for everyone. What matters to you matters to us. Learn more at caringformanitoba.ca.
Doctors Manitoba and the physicians and medical learners of Manitoba work and live on the treaty territories and ancestral lands of the Anishinabeg, Anishinaabe, Dakota Oyate, Denesulin, and Nehethawak nations, the homeland of the Red River Métis, and the ancestral lands of the Inuit. We respect the treaties that were made on these territories. We acknowledge the harms and the mistakes of the past. We recognize these harms continue today, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of truth, reconciliation, and collaboration.
Okay, standing by for camera 3. And good evening and welcome. I'm 680 CJOB's Richard Kluche, and wherever you are this evening, whether you're joining us live or a little bit later, want to really thank you for being here, as over the next hour, lots of information, great conversation about one of the key issues in Decision 2023, healthcare. We have lots to get to in the next several minutes here. We're going to hear from the three main party leaders as well. But since we are at Doctors Manitoba, best to start with our host this evening. Dr. Michael Boroditsky is an obstetrician, gynecologist, current president of Doctors Manitoba, and last month part of the release of the plan on behalf of doctors here in the province called the Prescription for Healthcare. Invite you to go online and get a read of it because it's a very interesting document. It's recommendations from physicians on what's needed to stabilize and improve the healthcare system. It's not lost on me, Doctor, good evening, that we are like between two ferns here. What's the deal here?
Which one of us is Zach?
Well, I have put on a little bit of COVID weight.
Oh, come now.
Doctors Manitoba, why is it important to have this type of town hall?
Well, from Doctors Manitoba members' perspective, healthcare is always on the forefront of our mind. And I think for all of Manitobans, it's a key issue. And the leaders that have spent their time to come here recognize that it's important to talk about it, to find answers.
I think we all have a story. We know somebody, we're either personally affected by this, but what do you believe are the big challenges in healthcare right now?
I mean, there are many, but I think the biggest for sure is access to timely care. We have a major shortage, as it's been said time and time again, of family physicians, primary practitioners. Our primary care, which is we believe to be the foundation of healthcare, is having struggles to keep up with the demands. And I believe that that's probably the main focus that we need to look at right now.
All exposed certainly during COVID, but even before COVID, we were having those types of conversations. When we talk about primary care, what do we mean?
So primary care is basically for everyone in the population to have a provider to go to when they have issues on a continual basis. But they also have providers to go to after they've had significant events to support them to reacquisition into their community, to be at home with their family, to have things that are done not in the main tertiary hospitals, but out in the communities, however we see that.
And it's those connections that you make, not on a temporary basis,
Yeah.
but over a lifetime, that is so very important. It's pretty basic. It's that doctor-patient, but it's a team, isn't it?
There's no question it's a team. And, you know, touching on the doctor-patient relationship, I mean, that can't be overstated. I mean, physicians and healthcare providers can't fix everything, but if you have the ear of a patient, if you have time for the patient, if you can listen to the concerns, that helps as well, and we just don't have that presently.
So talk about the document, the recommendations in that document, and how it applies to what we're talking about this evening.
So you're referring to the prescription to healthcare that we put forward. So there's 7 points Team-based care is probably one of the primary ones, and that's where you talk about multiple people coming involved, whether it's physician assistants, nurse practitioners, pharmacists, working in a team-led process by physicians. We do talk a lot about recruitment, retention, but it's more than just physicians. It's focused recruitment, focused retention, appreciating the providers and making people that are here want to stay here and making this the place to work.
Fair to say it took a while to get into this. It's going to take a while to get out of it.
This is a big ship. It's not moving overnight. It takes time to move the needle for this, but you have a lot of people. All of our members at Docs Manitoba are dedicated to it, and there's a will. We just got to figure out the right path, and it's not easy. There isn't a right answer.
Well, and I think our leaders are all committed to that, and we'll hopefully find out a little bit of the differences and the nuances here. Yeah. What are you and your members hoping to take away from this evening? Because we're all watching, and again, we have that healthcare story. What are you hoping to accomplish this evening?
Well, first I'd like to thank the leaders for coming here. I mean, that is immense for our members, for the population of Manitoba. But I'd like to really get into some of the hows. I'm not a politician. We are nonpartisan at Docs Manitoba as well. But I hear lots of things out there of we can do this and that, but I really want to know how they plan on doing it. A little bit more meat on the bone would be something that I'd be looking at today.
Well, I'll try. I'll absolutely try.
I appreciate it.
And it's important that if you want to learn more about the template, to check it out here on the Doctors Manitoba website as well. But when we look to the future, and I think the conversation that we're having right now, we haven't touched on ERs. Often, that seems to be the focus. But what I'm hearing, and as I read this, it's more about the big picture that we need to really focus on. Emergency, while important, it's at that kind of critical crisis end. We're trying to really prevent crisis from happening in the first place.
100%. And not only prevention, but the ERs are the end game. I just spoke to a friend of mine today who's an ER doc at St. Boniface, and he goes there and the wait is immense. He comes in and there's a 97-year-old waiting 18 hours. Who wants to do that? But the problem is there's nowhere to put patients. So the ER is one thing, but where do we put a patient if they're admitted? Well, we don't have admitted beds. How do we discharge someone from an internal medicine ward when there's no home care beds? How do we get someone into their own home when we don't have enough people that work home care? So the ER is the end game that's getting clogged, but there's so many other long-term infrastructures that have to be fixed.
And I look at the demographics, not just of this province, but of the country.
100%.
And when it's 1 in 5 of us over the age of 65, and then it's 1 in 4 in our lifetime. And so there's a whole host of issues that probably go beyond healthcare, but those are the conversations we need to have.
We are living longer, and yes, we do have healthier lives because we're living longer, but we need care, and we need timely care, we need access to care, and I think there's a way to do it. We just need everybody getting together and pulling in the same direction.
All right, Dr. Michael Boroditsky with us here. Doctors Manitoba. Now, thank you again. Really appreciate it.
Thanks very much.
Now, what we're going to do this evening is rather unique. This is not a debate. This is more about a forum. And that allows us to have one-on-one conversations with the leaders. Now, we've done a draw, and later this evening we'll hear from the NDP leader, Wab Kinew. We'll also hear from Dougald Lamont of the Manitoba Liberal Party. But we'll begin with the leader of Manitoba's Progressive Conservatives, and welcome Heather Stefanson. Great to have you with us.
Hi, Richard.
Appreciate it.
Great to see you.
Great to see you. Yeah. I'd get up, but then, but yeah, welcome to the two firms.
Great to be here tonight.
How are you, first of all? And I know you want to thank our hosts for this evening and I'd like to thank you. This is a unique type of broadcast. Yeah. And it's an opportunity to have a conversation, so I really appreciate
Absolutely
that.
It is. I want to thank Doctors Manitoba, Dr. Michael Boroditsky, as well as Teresa Oswald and everyone else who is involved with Doctors Manitoba, and particularly all of our doctors out there who are working and helping keeping patients healthy and safe and in our community, and for everything they've done. There's been some challenging times, and I just want to take this opportunity to say thank you. I think this is a great forum to have here tonight, and I'm happy to be a part of it. I think it's a great conversation to have.
So let's get to it.
Okay.
We have about 10 minutes here.
Sure.
And I'm curious, do you think we'd be having this conversation about healthcare in the way we are had there hadn't been COVID?
I think that one of the biggest challenges, and this is not just, I think COVID has made things a little bit worse, and this isn't a challenge, like health human resources is one of the biggest challenges that we're facing in not just our province, but it's right across the country, and that's why we've developed our action plan to recruit, retain, and train more healthcare professionals. We've already reached our goal, a $400 million investment, 2,000 more healthcare professionals at the end of August, but we recognize there's much more work to be done. And that's why we're committing in this campaign another $30 million annually.
So we're going to try to get away from the what and talk about the how in many respects. And what do you believe is the biggest longer-term challenge of this system right now as you look at it?
I think it is health human resources, and that's going to take some time to get us back up and running. So again, we've already moved in that direction, but we've also we are out in the field right now looking for 150 more family doctors as well. So 50 for Winnipeg, 50 for rural Manitoba, 50 for northern Manitoba. We recognize, Dr. Borditsky was talking about this earlier, about that need for care in those communities as well, and we recognize that, and we're already moving in that direction.
Well, and it's interesting because I'm interested in the how, because so often, you know, we talk about the doctors, but this really has to be a team concept.
Yeah.
In the fact that, you know, I'm thinking of that old relationship that you have with the doctor and the team. How do you envision that in the future as far as the relationship that we have with that healthcare team? Where is it? Is it a hospital? Where? Give us an idea, a sense of where you'd like to see this go.
Well, I want to thank Doctors Manitoba for putting together their 7-point plan. I think it starts with those teams in communities, helping in communities, and so I think that that's a great idea, and we want to work, you know, with them on this. This is not something we can do alone. It's something that we need to work together on. And I will say, you know, I hope the feeling is mutual, but I feel that in the last, you know, just under 2 years that we've developed, you know, a much better working relationship with Doctors Manitoba, where we've been able to work together on some of these things, where we've got an agreement with Doctors Manitoba on this, and part of that is recruitment and retention and training and all of those things that are keeping doctors in Manitoba as well, and so we got to continue to work together on that.
You mean it was strained before? In traveling in rural Manitoba, and I've spent some time, and I know you have as well, in rural Manitoba, there's a real sense of, and I'll use the word betrayal at times here, because they think that there's a bunch of people in Winnipeg making decisions about local health care in Melita, in Deloraine, in Verdun, in some of those southwestern communities up in northern Manitoba as well. And they don't feel that they have been heard, and that they don't like the idea of shared health and the regional health boards imposing their will on these communities. So much so that a lot of these communities are rebelling and recruiting on their own. How do you deal with that as the prospective premier, given the fact that you've got this kind of planning process, but you also have mayors and reeves that are seeing that healthcare hasn't improved? It isn't closer to home.
Well, I mean, I think the pandemic has been a challenge in all of that, but it all comes back to recruitment and retention of doctors and other healthcare professionals in communities. And that's why we have, you know, embarked on 150 more family doctors. 50 of those will be in rural Manitoba. If you look at Brandon, we have created a hub there in Brandon, $139 million into the emergency room there, enhancements to cancer care there. We recognize, and $10 million more as well, ongoing for recruitment and retention in rural and northern Manitoba. So we recognize there's a challenge, but we have to work together with municipalities.
Does it keep them there? Because often a doctor will be there for a year, 18 months, and boom.
Well, that's where we really have to work with communities to see about the retention. And part of retention is not losing doctors to other provinces. So it's creating a competitive taxation environment. That's where we just increase the basic personal amount to make us competitive across the country. So the taxation, I think, is a big part of that too, creating those incentives to stay in Manitoba.
We're with the progressive conservative leader, Heather Stefanson. I'm 680 CJOB's Richard Kluche, Doctors Manitoba, a very special broadcast about the future of healthcare in this province. A lot of the questions I have here are from you and members of Doctors Manitoba, and one of them really goes to the thrust of future and the fact that we are an aging population. What's your plan to deal with that, not just on that healthcare side, but to deal with somebody that, you know, is not sure where they're going to end up in 5, 10, 15 years from now?
Yeah, and we have our own senior strategy as well that we have announced, and looking at the village model so people can age in their communities, age at home with the supports that they need. So we're offering that as well. And we'll continue to work with seniors on that.
You're going to have to build a lot more personal care home beds.
Not necessarily. I think, you know, we're already doing that. We've already surpassed our 1,200.
You've got a lot of old stock.
Yeah.
A lot of old stock
Yeah.
that really during COVID exposed that
That's right.
it's aging. And, you know,
More work to do.
fundamentally, you've got to do some building here.
Yeah, more work to do, there's no question, and we're committed to that. We've already committed to over 1,200, that was our target. And, but we recognize this is not going to be fixed overnight. It didn't break overnight, it's not going to fix overnight.
Here's a question from one of the doctors who last week saw that the Progressive Conservatives promised expanding the scope of practice for pharmacists to do some of what a family doctor or nurse practitioner can do now. Meanwhile, many people advocate for more team-based care where providers like doctors, nurses, pharmacists work together. How would you move the pharmacists' help improve health care for patients? What would your government do to manage the ethical concerns about keeping those prescribing medications separate from those who are making their money on selling and dispensing those medications?
Yeah, I think the idea there is to get more access to those you know, services that are needed in the community, but I still think that team-based approach is the way of the future, and we need to look at that and how we're all working together. But for right now, if people are waiting to get in to see a doctor, and really it's just, you know, for things like a urinary tract infection or something along those lines that's a little bit more simplistic where you can see, you know, a pharmacist for that, then I think if they can help alleviate some of the pressures in the system, we're trying to help doctors in the system, not trying to take away from what their scope of practice is.
How would you and what would you do on the mental health support side? Because I think one thing that COVID certainly told us is that people are, it hurt hard, but now people are willing to do something about it. And it's really, if you're a young parent trying to access mental health services, not necessarily on an emergency basis, but an ongoing basis, it's tough.
Yeah, it is. And, you know, we have added 17 new clinical psychologists to the system. Again, there's recruitment and retention that needs to take place there. It's not going to get fixed overnight, but we have increased, we have already put 1,600 positions in place for addictions care in the community, and we've just announced another 1,600, and I think that will help on the addiction side as well.
Doctors, for the most part, are contractors, and I remember back in the Dewar days, there was, you know, the Maple Surgical Center and how they got into the market. Where's the private contractor play in a Heather Stefanson progressive conservative kind of regime here? Where does that, what's the role of that?
Well, I think like it was expanded back under Gary Dewar to Maple Surgical, Western Surgical. We would like to expand, of course, during COVID when we were trying to deal with the surgical and diagnostic backlogs. We did contract out those services often to the private sector out there to be able to increase the capacity so that people could get the services that they needed. So we're willing to do that. I prefer not to be sending that down to the United States or other provinces. I prefer to be doing that right here in Manitoba.
You and the NDP leader at the Chamber debate pledged no more lockdowns. What if we need to lock down again?
So listen, I mean, we're going to see whatever's dealt with us, whatever we're dealt with. But for right now, I think we know more about COVID. We know what is, you know, we've got the tools in place, more tools than we had at the beginning. We've increased capacity in certain areas as well, and we'll continue to increase that capacity. You know, one of the areas is the surgical capacity. We're now back to pre-pandemic surgical capacity in all of our sites and have surpassed that now. So that increase in capacity is absolutely critical so that we don't have to look at things like lockdowns in the future.
But if Dr. Roussin were to say to you, we're having a real tough winter, the convergence of COVID, flu, RSV is such that, Premier, I recommend that you go to a lockdown. You're not going to get in the way of that, are you?
You know, I think where this is at is that we've increased that capacity. We've learned so much from COVID that we need to make sure that we've increased the ICU capacity, we've increased, the surgical capacity. The reason for those lockdowns was because the system couldn't handle the number of patients. So by increasing the capacity within the system, we shouldn't have to go back to those lockdowns.
Heather Stefanson, thank you so very much for joining us.
Thank you very much.
Heather Stefanson is the leader of the Progressive Conservative Party of Manitoba. Thank you so very much.
Thank you.
Our next leader is just ahead here, and we're just absolutely thankful that the three of them could join us. A lot of our questions are from doctors who are in this room or watching and joining us on Zoom or online on YouTube. Our next leader to join us here at Doctors of Manitoba on this very special broadcast is the Liberal leader of Manitoba, Dougald Lamont. Mr. Lamont, come on down here.
Come on down. Is the Price is Right?
Well, let's find out.
All right.
Good to talk to you. Good to see you.
I'll try to get up to the point but not go over.
Thank you very much for joining us. Do you believe that we have learned the lessons of COVID?
Absolutely not. Yeah, look, COVID was an incredibly brutal time. And I used to work at the International Center for Infectious Diseases in communications during the H1N1 pandemic. It was incredibly painful, not just because we were continually making recommendations for things that would solve things, because we were hearing from experts, we were hearing from long-term care facilities that nothing was being done. And one of the hardest parts about the pandemic for us was continually warning people. And then a disaster would happen, and then someone would say, well, we had no warning. What could we possibly have known? It was traumatic, to be honest.
Again, a lot of the questions are coming from you, and several physicians and patients wrote in concerned about the crisis in primary care. 150 to 200,000 Manitobans without a family doctor or pediatrician, and many of those who have one can't get in to see the doctor as quickly as they'd like to.
Yeah.
How do you change that? How do you deal with that?
That was actually the key to our first healthcare announcement. It is the absolute cornerstone of what we want to achieve, is making sure that every Manitoban has a family doctor. We are way, way short because of years where we've throttled the amount of training that's happened in Manitoba. But there was a great insight I had sometime, I can't remember if it was the strike at the U of M, but somebody said, look, our healthcare system would not be able to run without the University of Manitoba. And we basically have a factory for making nurses and doctors and approving nurses and doctors that we could expand. So we need to expand training. So we've committed to, it's already happening to some degree, but we don't have enough teaching spaces at HSC. We would invest directly into the University of Manitoba to expand its capacity to train new doctors, add the number of international medical graduates, and the other thing is to add the number of, expand the number of residencies, because that actually was cut. At some point, when the PCs were freezing and cutting, they closed a number of clinics, which were teaching clinics. So we actually ended up losing teaching positions to the point that the accreditation of the University of Manitoba was almost put at risk. So you have the training component. The second part of it is the pay component, which is to say you introduce a kind of flex pay to increase salaries for family doctors. It's a simple insight. Dr. John Gerard met an old friend of his who's the head of the Ontario Pediatric Society. He said, in jurisdictions where there are more family doctors, it's lower cost and people are healthier. So that is why we have to push towards that system. Our system is in terrible shape, but we have the opportunity to try to push it in a new direction of prevention.
Incentives in the north, in rural Manitoba, where would you provide incentives?
So 3 types of incentives, actually. The number one incentive is to actually provide a kind of flex. It's got the worst name in the world. It's called fee plus capitation. It sounds like a threat. It's terrible. But it means that you're paying people. But look, if you have a patient who needs to take more time, if they're older, if they've got diabetes, if they're an expected mother, you take a bit more time with them so they have better care. So you pay doctors, that ends up increasing physician pay. So that makes it more appealing. The second part is a top up for working in teams. So you have a team clinic because they're not paid right now. And the third thing would be a top up for rural and northern medicine, because we've seen this, and part of this is because there's an incredible clinic at Opaskwayak Nation called the Nuka Clinic. It's mind-blowing. In the first 6 months, they saved $700,000. They reduced hospitalizations, they reduced amputations, and they reduced flights out of the PA because people were able to take better care of themselves.
Well, and I've been there, and the PA, and one of the challenges on the PA side is the aging infrastructure that they have there, and retaining doctors, nurse practitioners, et cetera. But I also had a conversation, I brought this up with Heather Stefanson, the mayor of Melita, Manitoba. Their 85-year-old doctor retires in December. And, you know, a lot of these rural reeves and mayors have kind of taken it upon themselves to go out and recruit. And the 85-year-old doctor may have worked 60, 70, 80 hours a week, but the doctors I know who are a lot younger want a different lifestyle. Is that all part of the concept that you would bring in, that this really has to be a change, because the doctor of today does not want to have to work, you know, that 60, 70, 80, 90 hour a week?
And I think it's also hard being isolated. If you've been to the Nuka Clinic, it's the happiest place in healthcare you've ever been in Manitoba. They love their work because they know it's working. So that is part of it, so that you have healthcare extenders, right? So if you'll have your primary care physician, you might have a nurse practitioner, you might have an EMT, so the doctor actually gets some time off, and it makes it that much easier. But the other thing about it is trying to make sure and encouraging people to live there, so that we're not having people shifting back and forth or commuting. It's about encouraging people to be part of the community and downloading some of that. There's too much control at the top of the bureaucracy. Downloading some of that control and those decision makings to the local level, so that they have more decision making. They don't have to always be going to shared health for permission.
Resources the biggest challenge right now?
I would say the two biggest challenges, one is shortages of everything. We are short on nurses, doctors, psychologists. Because we have taken too long, and it's been known that we're facing this challenge for 20 years, that we're going to face all these retirements. It could be, I think that your own Doctors Manitoba numbers are up to 800 that we have to replace, or 700, but we have to encourage people to stay. The other is providing incentives in healthcare, bonuses for nurses, bonuses for healthcare workers, sort of thank you bonuses, bonuses for healthcare teams, as well as attraction bonuses to get people back from care into the system. That would be based, so you have $10,000, and if you're working half-time, you get 5.
So that perpetuates the existing system. I think there's a lot of people, certainly in this room, that are watching right now that are saying, you know what, this stuff really hasn't worked, and COVID proved that. How would you change things? What would be some of the changes we would see if we handed you the keys?
Well, I'll say one is focusing on prevention, because part of the reason our healthcare system doesn't work as well as it should, and it's so expensive, is because we keep investing in crisis care, right? So it's all about emergency rooms, it's all about urgent care, but we don't actually put the money into preventing diabetes, right? So we've said, look, we should be doing everything we can to prevent diabetes with free insulin pumps, CGM monitors, so that because we can be preventing hundreds of millions of dollars possibly in costs. The same thing with providing mental health care under Medicare. For every dollar you put into that, you could be reducing 2. But the other thing about it is that there's a culture. People talk about a culture change. One of the biggest challenges in healthcare is people need to be free to speak out. When I taught at the University of Winnipeg, I read a paper called about normalized deviance in healthcare. It's the greatest thing you'll ever read. It's like a horror story, but it's about how good people start doing things and about how broken practices become normal. And the key to it is having uncomfortable emotional conversations and allowing people to speak up. And I don't think that's something that can happen. It's one of the hardest things we can do to make healthcare better. It's free, but it is one of the single biggest challenges because it requires a political revolution, perhaps a Manitoba Liberal political revolution in healthcare.
But you're talking about culture. You're talking about culture where, and this has always been the challenge within many areas, not just medicine, but certainly in medicine, to be able to to speak openly
Yes.
and freely within teams. And, you know, and I do think in a generation or two, doctors have come a long way,
Yeah.
as have other healthcare practitioners. Several questions that you've asked, and there was one, you've promised a family doctor for every Manitoban, you've promised to shift from the current fee-for-service model to flex pay. You've touched a bit on that,
Yeah.
but they want to know, how would this address the current crisis with primary care and help recruit more doctors to Manitoba?
Well, the idea is that well, there's two things. One is that we would expand training, but part of this is that it is a financial question, is that if you have somebody who can make better money or can make good money making, it's just a question of an incentive in family practice as opposed to as a specialist. That's one of the reasons about it. This is why it's recommended, and it has worked in other jurisdictions. But the other is significantly expanding that. The one other aspect for it is to expand and have a U of M faculty at Brandon, which specializes in training family physicians and others for rural and northern practice. So you take people who want to work in rural and northern Manitoba, they go to Brandon, they get trained under the guise of under the supervision of the U of M Medical School. But that's a way of expanding capacity, because those are people who actually, they're from Manitoba, they want to stay in Manitoba. And also, I will say, there's so many problems. Addressing the issue of people who are in Manitoba who cannot get their credentials recognized.
I'm sure this will come up with Mr. Kinew, but I want to get your thoughts on this as well. Reducing in Winnipeg 3 ERs and the whole idea of doubling it back up at some point.
Yeah.
You know, the Peachy report made some recommendations, and it's not just about emergency rooms.
Yeah.
There was a whole shift in healthcare. If you were premier, would you shift back? What would you do to deal with what a lot of people are saying is something that exposed itself during COVID? What would you do?
Well, look, there's two things. One is that, again, John Gerard made the point that often after a crisis, the system is stronger if you have actually invested in the public system. But we didn't do that. It fell apart. And the reality of a pandemic is that when you have sick cases doubling every day, there is no way that the system can possibly handle it. It was the issue with the ERs, and just saying you'll reopen them, I was saying, look, if I knew this was going to be the 2031 election, I would have promised that 8 years from now I'd reopen an ER. But fundamentally, when you look at what the problems with our ERs are, if you look at the Brian Sinclair report, which was absolutely tragic, but the issue there was flow. And it's not just what's in the ER, it's about the fact that there's nowhere for people in the ER to go. So you have hospitals filled with seniors who should be living somewhere else, who should be in PCHs, so we have to create those spaces. And the other is you have people who are at the ER because there is no other place for them to go, because they're homeless, or because they're a senior with dementia, or because everything else is closed. So part of it about it is not just expanding emergency room capacity, it's actually finding places for other people to be treated, which means community care, expanded clinics, expanded urgent care clinics. Those are the kind of investments we need to be making, because it's about, and again, it goes to prevention. If we're making sure, I'll give you another example. We've said we'd like to see nurse practitioners in PCHs. And that would actually reduce visits to the hospital, it reduces visits to the ER, it reduces your healthcare costs. So it's all about, instead of spending tons of money on crisis care, it's about investing in preventive care to stop the crisis and to reduce the crisis costs and reduce the hurt. Because ultimately, these are people getting hurt, and that's what we have to do.
Dougald Lamont, great to talk to you. Thank you so very much for joining us this evening.
Well, thank you so much.
The Liberal leader, Dougald Lamont, joining
Thank you.
us here.
Thank you. Now what do I do? Did I win?
Exit,
Did I win anything?
exit
The price is
stage right. Don't forget your mug. Otherwise, we're going to have lots
the
of
mug.
mugs here.
Okay,
Everything
all right.
like that.
Mine is the one without the lipstick on it. Okay, thank you.
Richard Cloutier with you. We welcome the NDP leader. With us here is Wab Kinew. Mr. Kinew.
Hey, Richard, how's it going?
It's going really well. Good
Nice
to
to
see
see
you
you.
again.
Yeah.
If you're just joining us, I'm 680 CJOB's Richard Cloutier. We're at a very interesting and special forum for Doctors Manitoba. It's not a debate, it's a conversation with the leaders of the Manitoba's 3 major parties. We've heard from Heather Stefanson, the Progressive Conservative leader, from Dougald Lamont, now Mr. Kinew. How are you?
I'm doing good. It's nice to be up here as the two people with the least amount of post-secondary education in the room, or of anybody watching on Zoom. So I don't know what we're going to add to the conversation, but let's go for it.
Well, I think there's a lot. And first of all, I think a lot of people are concerned generally about ER wait times.
Yeah.
And I'd like to know from you what you believe is the most pressing concern right now within healthcare.
The most pressing concern within healthcare is the staffing crisis, I would say. And the number one issue that needs to get addressed in the staffing crisis, the thing that we have to do to prevent us from just throwing more money at the same broken approach and expecting different results, which aren't going to come, is we have to fix the culture within healthcare, the culture within the workplace of healthcare. There's been an infantilization of physicians and other healthcare professionals who are the experts. And because of the way that the upper echelons of the bureaucracy have been built up and really concentrated on over the past 7 years, you're seeing frustration. You're seeing people on the front lines who are burnt out and who are voting with their feet in some cases, and in other cases are speaking out for the first time.
So what does
ever.
that mean? You get handed the keys. Are you starting town halls? Are you telling people, you know, you're allowed to speak freely now? What does that mean as far as changing the culture? Do you change the leadership at the top?
Well, I think we'll have a fair process. We'll give people a chance to update their skills, but we need more emotional intelligence. We are going to set a clear message to healthcare leadership in Manitoba that we want you to improve staff morale and reduce wait times and do it according to our timeline. And if you can't do that, we're going to find people who can. But we will give people the opportunity to adjust to the standards that we're going to set, should we earn the right to form government here in Manitoba. But I think it's really important that we bring the freedom of speech back to the bedside. We bring freedom of speech to nurses and physicians who have those local solutions. They see firsthand how they can improve things in their own local situation, whether that's in a personal care home or in a hospital or any other setting. And certainly the attitude of reprisal and retribution that has permeated healthcare is not conducive to improving patient care.
So
that
let's
needs to
say
get
some of
fixed.
those doctors say, you know what, Kinew, you got elected by promising, or you're trying to get elected by promising to reopen 3 ERs. But really, successive governments, dating back to the 1970s, had talked about, we have too many ERs in Winnipeg. And frankly, as somebody that grew up in the South End, we all knew if it was complicated, you go to Children's. If it was bad, if it was heart, you'd go to St. Boniface. Trauma, you go to HSC. Victoria, pretty good hospital, but you know, the ER was an ER in name only. It's been in urgent care, they would say, for 20 years. What would be your criteria? What would be your marching orders in order for a Victoria to be back to an ER? And spend the time, get specific.
First of all, it has to start with the staffing. And this is why we came out, and the first day we were talking about healthcare in this campaign, we talked about staffing. A three-pronged approach, starting with plugging the hole in the bottom of the boat. So better working conditions, addressing the culture in the workplace of healthcare, and ensuring that we have compensation that's competitive. Second, bring in the reinforcements, training, recruitment. And then the third, build the healthcare system for the future. Clinician research roles so that we can develop homegrown talent, we can recruit rock stars from other jurisdictions to set up shop here and do research in areas that benefits the population here in Manitoba, but also meets the needs, clinically speaking, diabetes, multiple sclerosis.
So the Victoria ER, would that mean more doctors on staff? Would it mean an ICU? What would it mean
Not
as
an
far
ICU.
as...
No, an
Okay.
ICU is a volume game, and I don't think you could justify an additional ICU site at this point. But I think yes to more doctors, yes to more nurses, and then you have a series of step-down beds in that hospital next to the ICU, or next to the ER rather. We've also talked about bringing the Mature Women's Health Center to that campus and making further investments to build the Victoria site up into a fully functional community hospital. You've got 250,000 people in South Winnipeg without ready access to an emergency room right now. And you know, the Canadian Association of Emergency Physicians says to look at population needs. So when we're talking about the Victoria site, it's about meeting the geographic needs. When we talk about the CONC, it's about surgeries and ensuring that that Canada-wide recognized team of surgeons there has the tools to be able to do complex joint surgeries. When we're talking about the Seven Oaks sites, that's about 24/7 dialysis capability to reduce the interfacility transfers that are happening right now from our Kidney Center of Excellence and St. B and HSC.
So this doesn't happen until you get resources under control at HSC,
First
St.
step.
Boniface, and the Grace.
First step, we need the staff.
Yeah.
Second step, we need the buy-in from the health system leaders who tell us that the plan is ready to go and that it will be viable. We won't take steps to move in this direction that would destabilize healthcare.
And they'll come back to you and say, it's also about flow through, that we need to open beds on
100%.
units as well.
And we don't need to wait for new ERs to do that. Our plan, our platform calls for 40 additional beds at HSC. You're talking about another dozen at the Grace, more at St. B, and improve patient flow. But the thing is, we've laid out over the course of this campaign like an entire spectrum, a continuum of care. Emergency room care, the minor injury and illness clinic approach, incentives for family physicians to move to a primary care team-based model. We've talked also about home care and support in the community. We've talked about northern healthcare. So really, I hope that folks on the call tonight and folks watching along online appreciate that while we lean in to talking about emergency rooms because it's top of mind for so many Manitobans, we have articulated an entire suite of policy options to move healthcare forward, starting with improving the culture within healthcare
And
leadership.
I do want to talk to you about primary care because that's foundational. But
Yeah.
others would also say you have to also build more personal care homes. The aging situation in this province, we rely on immigration to get us, to grow the population. But when it comes to people still in hospital beds that should be paneled, there's still issues there. And I've made this a bit of a pet during this campaign. We've got
Rightfully
personal care
so.
homes. We've
Yeah.
got personal care homes that still have 4 to a room. That has to stop, no matter who's in power after October 3rd. Will you build new personal care homes to replace the existing ones that really were crippled during COVID? Will you do that?
100%. I'll commit that to you. I'll offer you my hand as a solemn commitment.
Okay, I'll take that.
Yeah.
We'll shake after.
Okay.
When it comes to primary care and the whole idea of how you structure primary care, talk about the role of the physician, the role of the doctor, and the team, and how you envision that. I ask you that because some of the people in this room would say, we really have to come up with a different type of funding model that really centers this around neighborhoods and communities and teams.
Yeah.
What would you do?
Well, what we've proposed is an incentive program, $25 million a year for existing family practices, so family docs already out in the community with relationships with patients, to bring on the nurse practitioner, the physiotherapist, occupational therapist, mental health worker, social worker, pharmacist, to build a primary care team within the clinic that they already have running. And this would be a province-wide initiative so that Manitobans, not only in the city of Winnipeg, but in rural settings in the north, would be able to benefit from the advantages of a primary care team. We know that DocsMB and the Canadian Medical Association is saying this is the way to go. CMA, for instance, has said every Canadian should have access to primary care within 30 minutes. The only way you're going to get anywhere close to that is by moving to a team-based approach, right? And so we're saying that financial incentives are a way to move existing family physicians into that direction. And then we're also contemplating seeding specific clinics using a team-based approach within certain neighborhoods in the city and in other regions of the province. And that sort of approach, I think, might appeal to some of the younger family docs coming out of med school who are looking maybe to start their careers in one of these team-based settings.
A lot of questions from doctors and from you, and we really appreciate that. And here's one of them, bit of a long intro to it, but it gets to a very important point. Privatization can be a third rail of healthcare in Canada, but of course we know there's already a lot of private sector involvement. Most of the nursing homes in Winnipeg are privately owned either by not-profit or for-profit companies. The Conservatives have signed contracts with some for-profit companies to provide services for patients that are covered by Manitoba Health. Gary Dewar, for example, 20 years ago did so with Maple Surgical Centre. Some have proposed allowing patients to pay for an MRI or minor procedure What is your position on privatization in healthcare? And is there an acceptable privatization that crosses, or unacceptable, that crosses the line for you?
Well, the person asking the question is right about the fact that there are companies active within our healthcare system right now. And you know what? I'm a fan of some of them. I'm a fan of the Lisa Monkman Medical Corporation, as one example. Then on the other...
That's his wife, by the way.
That's my wife's name, and Lisa Monkman. And then there's, on the other end of the spectrum, maybe you have big pharmaceutical companies where people are skeptical, suspicious of what the motives are, and presumably there's a whole spectrum in between those. And the question for a government is to find the right balance. And so I think the way we arrive at that balance is to look at the Canada Health Act. Right now, I don't think the balance is being struck in the most effective way because we actually had part of our Canada Health transfer clawed back in the most recent year because of a violation of the Canadian Health Act. But again, for me, there is going to be a role, whether it's, you know, a family physicians medical corporation or, you know, it's going to be, you know, other companies that are active in the space. But the question for me is, are we living up to the Canadian value of universal access to the public system, which I think right now is best articulated by the Canada Health Act.
One of the other follow-ups there is that the pandemic revealed public health and our public labs that have been under-resourced for years. Would your government increase funding to public health and our labs to better protect the public? And would those be public labs, private labs?
Yeah,
or both?
Well, I think CADM is in need of investment as the provincial public lab, and we're very pleased to stand with some of the folks who represent the workers at that lab, the allied health professionals being one, and to say that they endorse our plan for healthcare.
I asked you this during the 680 CJOB debate, and I held up the paper health card as a symbol of some of the kind of the archaic practices here that, you know, many of the people in this room are quite familiar with still using fax machines.
Yes.
What would you do to move the needle towards the future of healthcare? We've got lots to repair right now.
Yes.
But what would you do as far as the future of healthcare is concerned, both on the prevention and that relationship that doctor has with patient?
Well, in many other jurisdictions, the patient, you can just access your test results from your mobile phone as soon as the test results are ready. We don't have that in Manitoba. One of the reasons that we don't is because we don't have electronic medical records across our healthcare system, and we're still using fax machines. So we would like to axe the fax, if I can use, you know, a cheesy political slogan. And our platform does call for a consistent investment, both on the operating side, but also the needed capital investment to bring electronic medical records. Like, it doesn't make sense to me that we have an anesthesiologist at the HSC who we're paying very well-negotiated amount of money, to give credit to the people in the room here today at DocsMB, to go look for a paper chart, right? They should be caring for a patient rather than looking for a file folder on a wall. Similarly, the idea that people are waiting for surgeries and part of that wait is waiting for a referral to get faxed to another office, I don't think makes sense to a lot of Manitobans. So there's a lot of modernization that can take place here. It could deliver you the plastic health card that you want in the future. But I think that one of the pieces that we need is strong governance. So we need to ensure that FIA and people's privacy is respected. And I think that if you talk to family docs who are using AI as part of their transcription service right now, there is a whole train coming down the tracks in the form of what artificial intelligence is going to do to healthcare and the delivery of health in Manitoba. And while we're standing up these investments in bringing on electronic medical records and more empowerment for the patient, we should have a strong governance model that also has an eye towards the future and asks, how can we bring AI into people's clinical practices while still protecting the privacy of patients and also being concerned with jobs in the healthcare system?
One of the areas in my last question for you, and it's personal for you, it's the pledge that you would like to see more Manitoba children live to the age of 18, to have that 18th birthday. A lot of that has to deal with healthcare.
Yes.
What needs to be done, in your view, to create the conditions in this province so that more children become adults?
There's a whole suite of policy options. In a rich country like ours, congenital syphilis and HIV should be entirely preventable. So let's get out into the community with public health nurses, and let's give women and moms-to-be access to primary care and prenatal care. We saw that the prenatal benefit in Manitoba increased birth weight in this province, but it hasn't kept up with inflation, so let's increase it. MPI has access to where accidents are happening across the province with ATVs and vehicles, so let's use that data to guide a public health response. We know that there are major issues with youth suicide in too many communities. So let's have a province-wide anti-suicide strategy that is inclusive of a special focus on LGBT youth. We put all these things together, we're going to take important steps on primary and secondary and tertiary prevention to be able to move the needle on child mortality, which is moving in the right direction over time, but in my mind, it is not moving fast enough. And the reason why I want to talk about this as part of our campaign commitments on healthcare is that I recognize there is going to be a difference of opinion amongst medical professionals and other people in the public about, public and private and the balance there, how many ERs, what's the right approach to incent people to pursue family medicine. We're going to have a respectful dialogue on all those things. But tell me one person who doesn't agree with having more children see their 18th birthday. And so we want to do something very difficult, which is to repair healthcare in Manitoba. We want to bring more people to the front lines. We want to meet the needs of our changing population here in Manitoba and be running right along with them on their path through life. In order to do all those difficult things, we're going to need a North Star. We're going to need a common goal that we all buy into. And so part of our proposition in this campaign is we're proposing more young Manitobans reaching their 18th birthday. So when we do have those respectful disagreements, we can say, yeah, well, let's just park that for now and let's keep marching towards that goal.
And I would be remiss if I didn't ask you, with the entire last 12-minute conversation here, can you put a price tag on how much this all costs? Because a lot of people are watching and saying, very good, but how much does it all cost? Have you costed all this out?
Yes, we have. In the budget this year, there's $520 million in unallocated money. Everything we're talking about, not just on health, on affordability measures, on education, community initiatives, all of that will total less than $520 million in annual investments.
I will now shake your hand.
Thank you so much.
Mr. Kinew, thank you so very
Appreciate it,
much
Richard.
for joining us.
Thanks for the time.
Thank you very much. Take your mug with you. Got too many mugs here.
Don't let the door hit you kind of thing?
No.
All right, thanks, Richard.
680 CJOB's Richard Kluche. We do want to bring in one last guest who will help us end this 1 hour special conversation. And again, we really encourage you to go to the Doctors Manitoba website. And shameless plug here, tomorrow on 680 CJOB, we have all the leaders talking about healthcare beginning tomorrow morning on the start. Let's bring in Dr. Candice Bradshaw. Family physician, past president of Doctors Manitoba. Great to see you. Thanks again for being here.
Nice to see you.
Your reaction to what you just heard over the last 50 minutes here. Some depth, a lot of stuff we've heard before, but your reaction.
I think the first thing I have to say is just getting everyone to tune in to an entire 1 hour conversation about nothing other than healthcare is like a physician's fantasy, really, if you're in the political world. So I don't think this has ever happened before. And we got all three party leaders under one roof on our territory to come and hash this out. So this is amazing, and we really appreciate getting this opportunity and thank everyone for that. I think it's encouraging to hear unity on a few things amongst all three leaders. Everyone recognizes there's a shortage of family doctors, of all physicians, of all healthcare workers, that we need to focus on recruiting, retaining physicians, healthcare workers in general, and then training more physicians and healthcare workers. So at the University of Manitoba, increasing our medical school capacity, those sorts of things have all been mentioned, and everybody's campaigning to increase funding for healthcare in general. So I mean, all of these things are very encouraging. Everyone seems to have a very different way of going about how they're going to do all these things. So that is information that I know I personally need to process a bit more and sort of see where I see gaps needing to be filled in. And a big thing I have to say is just like listened to the healthcare workers on the ground who are slugging it out every day in the trenches and working hard. So if there's going to be big decisions made or big transformations of our system, these people need to be involved. I would like a voice.
My concern is that we throw a whole bunch of money at it and we're not moving the needle, that somehow there needs to be some fundamental changes here. Your document talks about how to move the needle, and there's probably a next document after that to talk about, you know, the next steps in this process. That's my fear, is that yes, we have to fairly pay people within the system, thank them very much for doing so and creating that culture. But are we really moving the needle when it comes to what we need to do to deal with an aging population and to deal with those prevention measures that, you know, a lot of politicians, a lot of people in the profession will talk about, but somehow it doesn't get addressed as kind of the primary goal here?
Yeah, you know, I mean, everything should really be monitored, and we need to have data, and we need to have people who specialize in policy and stats watching things very carefully, because we need to be able to stop and pivot and move in a different direction if we're on the wrong path, for sure.
I like the data idea, because to me, you can't go anywhere without properly measuring it. All right, you're a family physician. Talk a little bit about primary care, what you heard tonight, and where you believe we need to go, not just as a province, but as a country, because, you know, this, you've got that power of the, you know, the federal dollar here, our federal tax dollars influencing the process. What are the next steps as you see it in the weeks and months and years to come?
You know, you hear it across the country, and certainly in Manitoba, that we need team-based care in primary care. So yeah, it's great to have a clinic full of physicians and one nurse, which is the situation I'm in, but we need more. We need physiotherapists, we need physician assistants, we need the actual team members now. And that's not just a Manitoba thing, that's everywhere.
And what could you do with that? Explain that for us.
Oh, wow. How long do you have? I mean...
1 minute.
Exactly. So, like, I don't know if I can do that in 1 minute, but so a physiotherapist can help me treat a patient and avoid getting them onto a narcotic because they have no other option to get out of pain. A wound care nurse who is working in my clinic or consulting in my clinic can save a lot of hassle for home care visits and things like that. So, yeah, it's never ending.
Well, again, thank you so very much for inviting me to be a part of this evening. I'm Richard Kluche, and Candice, some last words for our listeners, our viewers here this evening.
Yeah, so thank you again for tuning in. It's a lovely warm fall evening. There were other things you could have been doing. This is really appreciated and dear to our hearts as physicians. Richard, thank you for hosting and moderating tonight. We couldn't have done this without you. And to all three party leaders, especially Premier Stefanson, Wab Kinew, and Dougald Lamont, really appreciate you dedicating time during a very busy week. Thank you.
And it's so important that you get out and vote in the advance polls now or on next Tuesday, voting day, October 3rd. Thank you again for joining us, and thank you for having me. Take care.
Thank you.